So a very good day to one and all. I am Dr. Rohit Gopinath, and today we'll be discussing about a very important topic, swellings. This particular topic is not only important from the clinical point of view, but also from the theory point of view. So you can expect a lot of questions as far as theory paper is concerned in relation to swellings. Not to mention that it is an important short case in clinical exams as well. So before we go into this topic in detail, it is very much essential that we understand the basic meaning, or we should understand this basic meaning of these three important words, swelling. So what exactly is swelling? Swelling is an enlargement of a part of the body, and the cause for this enlargement can be anything. It can be either inflammatory, it can be neoplastic, it can be traumatic, it can be infective, whatever it is. But the criteria is that a swelling should be well defined. Mass. Now, definition of a mass is a lesion whose extent is difficult to assess. For example, if I have an intra-abdominal mass, it is very difficult to exactly assess and measure the extent of the lesion or the lesion. So, what is a lump? That's the third important word. So, these three terminologies are what we encounter commonly in day-to-day practice. So, a lump is defined as a lesion noted within an organ or causing an alteration in the gross nature and shape of a part or an organ itself. For example, if you have a breast lump. So, when you have a lump within an organ, so the organ here is the breast. So, if you have a lump or a lesion within an organ, which is going to cause a distortion in the physical architecture and shape of that organ in which that lesion is present. So, breast lump, like I said earlier, is the most common lump that we encounter. So, before we proceed further, it is very important that we have a basic understanding regarding these three important terminologies. What is a swelling, what is a mass, and what is a lump? So, let's now go on to the first swelling, which is a lipoma. So, lipoma is a benign swelling arising from yellow fat. So, the terminology yellow fat means that it denotes mature adipocytes or adult fat. So, mature adipocytes have a normal nuclei and they are commonly seen in adult fat. The most important characteristic of mature adipocytes is that this fat does not take part in general metabolism. So, when a person tends to lose weight over a period of time, the body fat content might reduce, but these lipomas do not reduce in size because they do not take part in general metabolism. It is the most common benign tumor with an incidence of 2.1 per 100 people. It is called as an universal or ubiquitous tumor because it occurs in all areas except the brain. It can be localized or diffused. So, if it is localized, you find that it is well encapsulated with an yellowish orange color. If it is diffuse, you find this capsule may not be present. It is usually seen in those areas wherein it can extend further, extend deep, and it can extend over a large area. For example, like the head and neck region. In the soles, because there are tense fascia, the swelling may not be apparent very well. Palms, etc. So, it can be subcutaneous or it can be intramuscular as well. Lipomas can be superficial or deep. Superficial lipomas are the ones that we commonly encounter. They are seen in the back, neck, and extremities. They are usually smaller in size compared to deep lipomas, and which are usually around 5 centimeters, less than 5 centimeters. Deep lipomas are commonly intramuscular lipomas, very commonly seen in the lower limbs, trunk, and shoulder. They can extend to large sizes because they are not easily noticed in the beginning stages, and they are more common among men when compared to women. Lipomas can also be single in nature or it can be multiple. Single lipomas are more common. Multiple lipomas can occur in 15% cases, are commonly associated with Men's syndrome, Cowden syndrome, Froelich, and Proteus syndromes. There is an entity called multiple lipomatosis, wherein you have a young person with a familial history of lipomas. You have multiple lipomas occurring commonly in the shoulder and the pelvic girdle. And this familial association is noted in 30% cases. Another very important terminology that we might come across with regard to lipoma is liposa dolorosa. So basically, it's also called Derkham's disease. Very common among females with a history of epileptic and psychiatric disorders, characterized by multiple lipomas, which are usually tender in nature, commonly occurring in the trunk and in the pelvic girdle. So these are few images which depict how a lipoma looks like. So this is a large lipoma you can see here, which is located along the medial border of the left scapula. And this here is also a lipoma. So it might look like a papilloma or a pedunculated swelling. So lipomas can also be pedunculated. So that is what I like to convey here. So this is a pedunculated lipoma. And the most important characteristic of a pedunculated lipoma is that it is susceptible for surface changes. So you can see here there's an ulceration here. So pedunculated lipomas, particularly in areas which come under a lot of traction, friction, etc., are very much prone for skin related changes like ulcerations. So this is an individual with multiple lipomas.